Hi everybody, my name is Amanda G, Psych MP, and welcome back to my YouTube channel, Mental Health Matters, where we're going to discuss all matters related to mental health. So I wanted to talk today about depression. Depression is a worldwide disorder. It's actually the #1 cause for disability worldwide, so it affects everybody. It doesn't matter what country you live in, what nationality you are, how much money you have or don't have. There is a worldwide prevalence rates of depression, and so it affects everybody. Almost everybody has knows somebody that's experienced depression or has experienced depression themselves. So I wanted to kind of go into the symptoms to look for and what you can do if you feel that you or maybe a loved one or a child is suffering from depression. So I treat across the lifespan in private practice from kids to adults. So I like to touch base on kids and adolescents and then kind of talk about adults. A lot of times with children, adolescents, teens, we do see depression or anxiety start, especially if there's a genetic component, around time of puberty, 13, 14 years old, 12 years old. So, and that can be a difficult time anyway, because by nature, the kids are going through so much change and their body's changing so frequently, and they're, they're learning about themselves, and it's just a very hard time developmentally anyways. So it's kind of hard to differentiate what are actual depressive symptoms and what's a normal junior high kiddo. So what I like to tell parents is, sadness, irritability, lack of motivation, concentration, sleeping habits that change, eating habits that change, crying, or for me, one of the biggest red flags is if your kiddo loved to do something, they were really into gymnastics, they were really into art, they were really into whatever, and now they don't want to do it at all. They've dropped it. To me, that's a big red flag that there might be something going on and would warrant a further intervention. So what do you do if your kiddo is experiencing some of these or does meet some of that criteria? I say that one of the best things to do, first of all, is take them to their pediatrician. Sometimes their pediatrician has treated them since they were a baby and so knows them very well and will be able to have a candid conversation with them. And other times might be their first visit with this pediatrician, but a lot of times they'll have a screening tool for depressive symptoms, and if they have a certain score, then the pediatrician will say, we might want to refer out to a specialist, talk to a counselor, talk to a psychiatric nurse practitioner, and see what kind of interventions could help. So in terms of treatments, there are medications that are FDA approved to treat kids that are suffering from depression. And that's a personal choice. You would have to talk with your kiddo and your healthcare professional about that. There's also therapy. Therapy is always first line. We know that it helps, it works, our brains can change. That's the good news. So I would say, getting a good counselor, a good therapist that your kid connects with and feels that they have a trusting relationship with and can talk with. And then always, I collaborate with other healthcare professionals regularly. I think it's the best way to provide comprehensive, all-around good care for your client. So if they're working with a counselor, talk with the counselor. Do you think we're making progress? Do you think things are getting better? Because sometimes it's hard to read kids. I have kids, so I get it. So if the counselor says, I think maybe we should look into seeing somebody that could talk about medications that could help, then you can go that route and see what the options are. But there's all sorts of things that can be done and that can help. In terms of medication, a question that I get asked frequently is, is my kid going to have to be on this medication forever? And the answer is usually no. So, typical time for somebody to be on an antidepressant is 9 to 18 months. And at that time, you can assess how your mood is, how you've progressed, your situations maybe have changed in your life. And if you feel that you're in a good place, then it would be a time to talk about coming off the medication. Some people have the preference where everything is going well, they want to stay on it, and that would be a choice that you could have too. So if you're an adult and you feel that you're suffering from depression, and certainly with the pandemic and the quarantine and the life changes that everybody's had to go through in the last 18 months, a lot of people have found themselves in a depressive state. There's plenty of data out there that showed that depression, anxiety, substance abuse have increased in the last 2 years directly to the pandemic. So you're not alone. That's the good news. And there's help. That's also the other good news. If you feel that you're depressed, you can reach out, like I mentioned with the kiddos, to their pediatrician. You can first talk to your PCP. A primary care physician actually prescribes 85% of antidepressants that are given, so they are a good first stop. And they may refer you to a specialist to really be able to hone in on what your specific needs are. And like I discussed, therapy is also helpful for adults suffering from depression. When we find the right medication with the right therapy and put those two things together, you're really going to see the best, most effective results. So the good news is that there's treatments, there's ways to help, and this doesn't have to be something that you suffer alone with for a long time. One of the things that's been positive about the pandemic, I think, is that people are now talking about their mental health. And so we're not pretending or hiding from it anymore, that it doesn't exist and just suffering in silence. So, if you are suffering and if you feel that you might have depression, reach out to your PCP, contact a psychiatric nurse practitioner, a psychiatrist, a counselor in your area, and discuss treatment options. Well, thanks for tuning in again. I hope to make more videos for you, more information on all matters related to mental health. This is the YouTube channel Mental Health Matters. And if you have any suggestions, comments about the video, or any topics that you'd like to talk about in the future, I'd love to hear it. And I can pop a video on for you. So thank you so much. I'm Amanda G, Psych MP, and have a great day.